An implanted port is a central venous access device that is surgically placed beneath the patient's skin. In order to utilize these devices, they must be safely accessed. This is a sterile procedure performed by the nurse. This video will list and explain the supplies that must be gathered and the preparations that must be done prior to accessing a patient's implanted port. At St. Mary Mercy Hospital, all RNs are allowed to access and de-access ports if they are comfortable and competent in the procedure. If it is the first time a nurse is performing this task, have a second RN present that is competent in the procedure to oversee and verify proper technique. This can be a nurse from the unit, or you can call the vascular access team at either extension 5672 or 2784. Once you have demonstrated the ability to successfully complete the procedure, you are safe to access or de-access ports on your own. Once you have identified that your patient has an implanted port, you will want to access it. You first need to gather the supplies. You will need sterile gloves. Have at least 2 pair accessible. In the event that you break sterility, you can quickly change to a new pair of sterile gloves and continue your procedure. Clean gloves. A microclave, sometimes referred to as a needleless adapter. A biopatch. Chlorhexidine swabs. A number of swabs may be available in the pod rooms. For this procedure, take either one of the large 10 milliliter winged applicators or multiple ChloraPrep single swab packs. A sterile saline flush. These come in various packages, but ensure that this is a sterile flush, not the standard saline flush supplied on the units. If you do not have one available, you can call distribution or the ICU and have one sent to you. An empty 5 or 10 cc sterile syringe. These are the syringes that are supplied in the pod rooms. An occlusive dressing. You can use any Tegaderm dressing that is large enough to completely cover the access site and device. In this video, we will demonstrate using the Tegaderm IV Advanced dressing, which should be available in your pod rooms. Surgical masks for everyone in the room. Swab caps for every open microclave and Y port. And finally, the needle or access device to access the port. The needles come in various lengths. The standard length is 3/4 inch, but also come in longer 1 inch and 1.5 inch lengths. Longer needles are only needed when the port is further away from the surface, so if the patient has significant adipose tissue or breast tissue, or if the port is implanted in the patient's leg or arm, you may find that you need a longer needle in order to reach the port. There are 2 types of access devices available, the Gripper Plus and the Gripper Plus Power Pack. Choosing the correct device is important. Some implanted ports are power injectable, which means that fluid can be pushed very quickly into a port with intense pressure, and the port will not be damaged in any way. This is important for some procedures such as CT with contrast, because the contrast dye must be injected in this manner. A power injectable port can handle this pressure easily. However, other ports are not designed for this level of stress and would be damaged or destroyed by the process. An explanation of how to identify if an implanted port is power injectable or not is provided in the linked video. Which brings us back to the question, which access device should I use to access this port? If you have verified that it is a power injectable port, use the Gripper Plus Power Pack. This device has power injectable tubing that will hold up to increased pressure. The tubing of the Power Pack is always blue, so you can tell which access device was used simply by looking at the tubing. If you have verified that it is not a power injectable implanted port, use the standard Gripper Plus. If you are unsure of what type of port it is, use the standard Gripper Plus. The tubing attached to this needle is clear. It is not power injectable. To ensure that no one attempts to power flush a non-power injectable device, we will always default to the clear tubed Gripper Plus if we have not verified definitively that the port is indeed power injectable. Both needles are designed the same. The needle is oriented perpendicular to the hub. These are used to access the port by pressing them straight down onto the port. The goal is to get the tip of the needle past the port's membrane and resting inside of the reservoir. Around the needle, on the base of the hub, is a foam pad. This serves only to prevent pressure injury on the patient's skin. It does not have any disinfectant quality, so you will be applying a biopatch under the device for the purpose of disinfecting. On the back of the device are small tabs to be used as handles to stabilize the device during insertion. Once in place, the tabs should be removed by squeezing them together. They will release from the hub like opening a chip clip. For more information on implanted ports, you can watch the full version of this video series, linked here, or watch other videos of this series provided in the linked playlist.